Hi, I'm Cassie Keaton, and I'm going to be performing special tests of the elbow, forearm, wrist, and hand. So first we're going to be starting with the elbow. So we're going to do the valgus stress test. So we're going to give, have support here, and we're going to give the elbow a valgus force. So push it in, and we're looking for laxity with that one, so we have to check it bilaterally. And if there's any laxity, that would be an indicator of an MCL sprain. Then we have the varus stress test of the elbow. So we're going to do a varus force. Sorry, I'm holding it wrong. Varus force, and again, we're looking for laxity. So we have to test bilaterally. And if there's any laxity, that would indicate an LCL sprain. Next, we have the passive lateral epicondylopathy test. Okay, so we're going to do palm up. Perfect. Okay, so we're going to bring the hand up into flexion with some ulnar deviation. Yep, up into flexion with some ulnar deviation. If there's any pain in doing that, then you don't have to do it all. That would indicate lateral epicondylopathy or tendinopathy. Then the active lateral epicondylopathy test. So you're going to support here, and I'm going to push down and resist that movement. You're going to pull your arm up, and if there's any pain or weakness there, then that would also indicate lateral epicondylopathy or tendinopathy. Okay, and then the passive medial epicondylopathy test. Okay, we're going to push it into extension, a little bit of ulnar deviation, and if there's any pain there, that would indicate medial epicondylopathy or tendinopathy. And then the active one here. Okay, you want to move it up into flexion, and we're going to resist that movement. Up. You're moving up. Yep. And if there's any pain or weakness, then that would also indicate medial epicondylopathy or tendinopathy. Okay, so the elbow flexion test, we're going to have elbows flexed up and hand out like that. And we're going to do it on both sides. Perfect. And they're just going to hold that for 3 to 5 minutes. If there's any numbness, tingling, or any signs of paresthesia, then that would be an indicator of ulnar nerve entrapment or compression. Okay, so then the special test of the wrists. First we have the radial ulnar collateral stress test. So so we have palm up, stabilize right there. So for the radial one, we're going to move it into ulnar deviation. And for the ulnar one, we're going to move it into radial deviation. And if any of those produce pain or laxity, that would indicate for the radial collateral ligament sprain or ulnar collateral ligament sprain. It's backwards. And because we're testing for laxity, we want to do that bilaterally. Next we have Phelan's test. So we're going to have like that. Perfect. Push those against each other. They're going to hold that for 1 minute, and if there's any numbness, tingling, or symptoms of paresthesia, then that would indicate carpal tunnel syndrome. Then we have the Finkelstein test. So you're going to make a fist and your thumb inside the fist. Perfect. And then we're going to do a little bit of ulnar deviation. And if that reproduces any symptoms, then that would be an indicator of de Quervain syndrome. Then onto the special test of the fingers. We have the varus and valgus stress test. So since it's most common for either the interphalangeal joints, we're going to test there. So we're going to apply either a varus force or a valgus force, and we're looking for laxity in the fingers. So of course we have to test bilaterally. If there's any laxity, then that would be an indicate of a sprain in one of the collateral ligaments. And then the last one is the trigger finger test. So we're going to take the affected finger, we'll say it's this one, and they're just going to move it in extension and flexion. And if there's any catching or locking or pain, then that would be an indicator of flexor tenosynovitis. And those are the special tests of the elbow, forearm, wrist, and hand.